The majority of hearing loss is due to age-related. As we age, our little tiny hair cells that we have inside of our ear, our hearing nerve, they deplete about 0.5% per year of our life. So by the time we hit a certain age, especially over 60, you're going to begin to have some type of a hearing loss. Medications, chemotherapy patients, sometimes hard antibiotics that are needed to save somebody's life can sometimes often cause hearing loss too. Sometimes you have sudden hearing losses. It could be a slight blood flow issue within the ear, or you could have an autoimmune disease, or it could be a viral infection inside the ear that causes a sudden hearing loss where somebody may wake up and have that hearing loss happen right away. On that note, I think if that does happen, that person should seek their physician right away. The quicker we can get individuals with sudden hearing losses in to medical doctors, where they potentially can provide them with a steroid to help get that blood flow back to the ear, they have a possibility of that hearing returning. But the longer they wait, that's the less chance of that. And the same thing goes with having a gunshot next to your ear when you're hunting with your buddies and somebody gets a little too excited. Noise exposures is the #1 cause of hearing loss. And if I could put it in perspective for you, if you're listening to your iPod and you're turning up quite loud, 15 minutes will cause damage. If you, it doesn't take long. If you are on a lawnmower, possibly an hour. Gunshots, instantaneous. Leaf blower, 5 minutes. Snow blower, 5 minutes. And so what happens is these little hair cells that we have are very, very fragile. Is when that sound comes in, it bends them or sticks them together or wipes them out completely. And hearing loss from noise exposure is an accumulative thing. So something happened today, then something happens tomorrow, and something happens next week. It all adds up to a greater hearing loss. So if you are having to talk over a sound, if things are loud, especially lawnmowers, snowblowers, guns, those type of things, definitely put earplugs in. I mean, absolutely doing that. I think I can definitely tell you, if you go see a professional football game, you should wear earplugs as well. And that place is really nice. But guns, if you're out hunting, absolutely want to wear ear protection. It just takes one shot for instant damage. So if you have a hobby with woodworking or any type of drills, and if you're a construction worker and that's the thing to do. And there's different options nowadays. You have those little tiny yellow earplugs you can get, but we have customized products where we can fit the ears. And what's nice about those products is they have a hole in the middle of the ear mold, and it has a little filter in there. So you and I can have a conversation. I can actually hear you through that ear mold. But as soon as a loud sound, anything from a gunshot to a lawnmower, that little filter will reduce that volume to a safe area. So that's really nice. And those aren't too expensive for those either. So lots of options nowadays. If you're a musician, I think it's great to look at musician earplugs. There's little plugs for musicians to keep the volume down. They also make those ear monitors too for them. I think it's a fantastic way to keep their hearing as well. I can't overemphasize that. I think children, we have to be careful with loud toys. Christmas is coming. You need to watch the volume of the toys. If you put the toy up to your ear and it hurts your ear, that's too loud for your child. Our children have really narrow ear canals. They can't take as much volume as we can with our larger ear canals, so it's even more amplified when that toy is up to their ear versus somebody else or an adult. So keep tabs on that. I think if you're buying something and you can listen to it, make sure that it's not too loud for the child. If it is, what I've done with my children, I put a piece of tape over it or a Band-Aid and try to reduce that noise a little bit. So.